So you've just noticed a lump in your breast. What next? One of the first things is that remember not to panic. Don't forget that it is just about 10 to 20% of breast lumps that are confirmed to be cancer at the end of the day. So the fact that you've noticed a lump in your breast does not necessarily mean that you have cancer. You need to relax and go through the necessary steps so that the right diagnosis can be made. That way you can get the right treatment. So what happens when you visit the hospital? In the hospital, your doctor will have to do a clinical breast examination. Your doctor will examine the size of the lump that is in the breast. We also look at the consistency. We'll look at whether that lump is attached to underlying tissues or whether it's attached to the skin of the breast or whether that lump is freely mobile in the breast. So all of these features helps your doctor. It helps us to be able to have a fair idea of whether this lump is likely to be cancerous or not. Now, after the clinical breast examination, we have to do certain imaging. This imaging helps us to further predict the likelihood of this lump being cancer or otherwise. So one of the commonest imaging modalities that we carry out when somebody presents with a breast lump is what we call a mammogram. I'm sure you've heard about a mammogram before. So a mammogram is simply an x-ray of the breast. So just as you've taken a chest x-ray before, we take mammograms of the breast. Now the mammograms helps us to localize the lump that is in the breast, to also determine the likelihood of it being cancer or otherwise. And then we usually will do an ultrasound scan of the breast. So the ultrasound scan most of the time will help us to differentiate between fluid-filled lumps and then solid lumps. The ultrasound scan usually complements the mammogram and then gives us better answers than when we do just a mammogram alone. In certain individuals, we may have to do something that we call an MRI. So there are some people in whom both a mammogram and an ultrasound scan are unable to give us the right answers. In that situation, we go ahead and do an MRI. So the MRI further gives us the answers and helps us to narrow down on the diagnosis. But don't forget, we still haven't gotten a diagnosis yet, because the only way to truly diagnose breast cancer, the only way to truly say that whatever lump that is being examined, whether it is cancer or otherwise, is by doing a biopsy. So in a biopsy, your doctor will take small samples or small bits of that lump that you've noticed and send it to the pathologist for a detailed examination. Usually we may use a fine needle aspiration, which takes just small amounts of the cancer cells. As the name aspiration goes, just small amounts. Alternatively, or even much better, we will do a true cut biopsy. With a true cut biopsy, your doctor is able to take much larger chunks of tissue and then send it to the pathologist for examination. The true cut biopsy is able to tell us much more details than a fine needle aspiration can. In some individuals, we may consider doing something that we call an excision biopsy. With a excision biopsy, your doctor will recommend that all of the lump is taken out and sent to the pathologist for an examination. Often, we will do an excision biopsy when the likelihood of that lump being cancer is low, in which case the excision biopsy becomes sort of a treatment for that lump that has been seen. So the pathologist is the only person or the only specialist that will confirm the lump that is seen, whether it is cancer or otherwise. At the pathology lab, that tissue that has been submitted is further processed and examined closely under the microscope. So the pathologist is able to identify certain features of the cells that allows him or her to say whether this is a cancer or whether it is not. Should the sample be reported to be a cancer, then we go on to do further tests that we call staging investigations. So these staging investigations helps us to be able to tell the stage of the disease that we are dealing with, whether it's an early stage breast cancer or whether it's a locally advanced disease, or in other situations, whether the disease that we are dealing with has spread to other organs or not. Some of these staging investigations include a CT scan, a PET CT scan, and in some situations we may request an MRI. So these investigations will help your doctor to be able to tell the stage of the disease. It is only after we have diagnosed and staged the disease that we are able to choose the right treatment that will be of benefit to the individual. So don't forget, finding a lump is not the end. It is only the beginning. It is the beginning of finding answers. And don't forget that breast cancer diagnosis is a well-determined or a well-defined and systematic and scientific process. And the aim of all of this is to make sure that we get you the right answers and also to help you get the right treatment that will be of benefit to you. I am sure that this video has been of much benefit to you. Don't forget to subscribe. Don't also forget to like this video, comment, and let us have a discussion on the comment section. I recommend this video to others and help them to know a lot more about what goes on in the diagnosis of breast cancer. Thank you very much, and see you in my next episode.